Hello and welcome back to our Carrier Product Update series hosted by Legacy Brokers. I'm Jason Powers and I'm here with two friends of mine from Humana Insurance Company, David Brown and Leah Daggett.
Hello.
Thanks for joining us. Thanks for being on the series.
Thanks for
Thank
having
you.
us.
We're excited to have you guys here. Humana is a big, really a big presence in our marketing efforts, and you're a great partner of ours. So we appreciate you guys taking the time out of what is a busy schedule these days. We're already in the heat of fourth quarter craziness, and I know you've got some exciting stuff going on. We see Humana on both the small group fully insured side and the level funded side, but we're probably leaning more toward the level funded product these days. Is that what you're seeing from your agents, Leah?
Yeah, level funded is one of our key products that I would say we sell within the under 100 segment.
That's great, and it's a super competitive product. It's still got the same network, right, David? I mean,
Yep.
Throughout the Kansas City area for sure.
Yeah, and I was just going to say we do offer it up to 99, but really our key segment here is 5 to 50, and then at 51 plus we do like to look at the fully insured product as opposed to the level funded. For the simple reason of this is that when we price our level funded premium, our claims trend is at 120% of claims. So that price is a little bit higher, but although you will have an opportunity to get a surplus back if you looked at level funded in that 51 to 99 segment, but you can get a better price point with fully insured.
Sure, that makes a lot of sense. The on the level funded side, I know in years past it seems like there's kind of been an incentive for groups to get off that January 1 cycle. What do you have Humana? What's Humana doing this year for fourth quarter?
Yeah, so we are offering a 15-month contract. So for our 12/1 and 1/1 effective dates, a group can elect to have a 15-month contract versus the 12 at the same price of the 12 months.
Great. So if they're on a 1/1 now, taking the 15-month puts them at renewal in April. The 15 months later, I guess.
Yes.
doing the calculation, right?
Yep, 2023.
Wow, that's keeping it at the same level, same price. There's not a premium load for that, right?
No.
We quote it 12 or 15 months, it's going to be the same rate.
Yep, if we quote it 12 or 15, same rate. We just got to make sure on the quote that we notate that it's a 15-month contract as well with the sold case paperwork.
That's great. And so that's I really think that agents they're already running pretty tight on the January 1 cycles. That's good to know.
Yeah, it's really to benefit your agents and your clients to get them off that peak season cycle and roll them into March, April renewal dates. After they renew that first time, then it reverts back to a 12-month contract, Jason.
That's the time of year where I don't want to do any more work, David. I'm like tired.
But your clients will love it because they're busy too during this time with Christmas and all the other things that are going on and activities. So again, it's trying to help your clients through this time of year.
For sure. And I know there's some other incentives for employers in this fourth quarter that we've seen. You just sent me an email, I think, yesterday with some details of that.
Yeah, so we are offering for our 12/1 and 1/1 new business clients a $200 per enrolled subscriber admin credit, and that will be shown on their third month invoice as an admin credit to the client.
Good stuff. All good stuff coming.
Yeah, so if you had like 10 employees, that's $1,000 back to your client.
Wow.
So, it's that's exciting to have as well to offer with that.
Yeah, that's huge, and that goes directly onto the bill. It's an admin fee credit. More than likely, that would take care of I would think pretty close to a couple months of admin fees on a level funded product. Just kind of depends on
Depending on the size of the group. Yes, absolutely.
Wow, that's fantastic. So all good stuff coming for fourth quarter. One of the main questions I think I get from agents as we're looking through Humana's quotes is some of the product names. I think we all know what copays are. We all know what the co-insurance product, and we've seen the HDHP plans from Humana for a long time. Simplicity, I think we've probably got fewer questions nowadays on the Simplicity product, but now we've got On Hand and Canopy. So talk us through what those products are.
Yeah, so On Hand is a cutting edge, first of its kind, comprehensive insurance plan that is based on virtual delivery of healthcare needs. So with it, it's affordable. You're going to see it's one of our most competitively priced plans on the quote. It's convenient, and it's really easy to understand. If you look at the quote, or if you look at how the plan is designed, members are going to have a unlimited $0 copay for virtual visits and mental health care, which is really big today.
Wow.
Through Doctor on Demand. They will also have $5 labs or common labs and $5 copays for your tier 1 and tier 2 prescriptions. And looking at our on-hand plans or our membership currently today, we see that over 70% of our members are using the tier 1, tier 2 prescription. So that's just $5 for the member. And then as well with that, it's very easy to navigate. We have members that are confused, what's deductible, what's co-insurance. And this plan is straightforward, 100% co-insurance. The deductible equals the maximum out of pocket. So all they have to worry about is what they're tracking towards that. But I think what's really sets this plan apart is we have a blood pressure cuff that's sent to the members, as well as a thermometer.
Oh my goodness.
Yeah, so they can help understand their health when they're speaking with their doctor virtually. But you also have a concierge team, which you don't see today. A lot of members are confused. How do I navigate the system? Where do I go?
Sure.
The concierge team reaches out to that member if they do need in-person care and can help find affordable, close providers that can help them with their services. So we look at it, and it's not gated. It's more of an extension of care for our members, getting that concierge team. They have a very sleek app that they can use to look up prescriptions. So you can go in there, add your pharmacy location, and it'll tell you the price at that pharmacy. And then you can also look at what the cost would be for GoodRx. So very innovative plan with the surge of virtual telehealth. I think this is a great product to offer as a base plan to some of your clients out there.
It sounds like Humana took a lot of feedback from members, member engagement, and really delivered a product that it's timely.
Yep.
You know?
Yeah.
Well, here's an interesting fact. Pre-COVID, our claims trend came in for virtual at about 2%. After COVID, we're now at about 55% of claims come in as virtual claims. So that this is a timely product for that. So now then you ask, or are there benefits for in-person visits? And yes, there is. And so if you so choose to go see your PCP, it's covered at 100% if you're doing preventive still. But if it's for other visits, such as you got a sore throat or something like that, then it would go to deductible co-insurance, or as Leah mentioned, straight to the out-of-pocket. So that's where it is. However, we just introduced 2 plans that have co-pays now for PCP and specialty visits as well. So you've got the best of all worlds on this plan.
Yeah, and I know it's gaining a lot of attention from our broker community because of the price point, and then it's our challenge has been trying to communicate why it's a different product. I mean, initially they're thinking, okay, so it's all virtual. No, it's not all virtual. You do have services or coverage available for services that are in person, but the steerage is toward virtual, and the reason for that is because we know in the industry the cost of care is so much lower on the virtual side than trying to have a brick and mortar building and staff that do all that intake. So it's an innovative product. I think this year we'll see a lot more traction, at least from our perspective, with that product, just having the timeliness of it. So
and member transparency, I think that's key. I have a high deductible health plan, and I know if I needed to go into the doctor, it's very confusing. I don't know where to go. Thank God I'm in insurance. So having that concierge team to help them navigate the system, having the app where you can enter in your prescriptions to see the cost or see if maybe utilizing GoodRx is a better option, I think is really key to help our members understand their plan, understand where to seek care.
And another really cool piece of this plan is that it's an HRA. It can be tied with an HRA. And within the app, the HRA can be tied to that. And so you can check your balances and stuff right on the app and follow those types of things too. So it's a good strategy for your clients and to offer an HRA alongside the on-hand plan, and so that they can also control and manage their health expenses.
Wow. And so the on-hand app, just so I'm clear, the on-hand app is separate from the My Humana app. This is a different, because of the product being a different style of program versus, say, the co-insurance products or the copay products. Because it is different, you guys have built a separate ecosystem for it.
Yes.
Yep.
Good, great. So now with on-hand, the one thing I think that a lot of people think of when they think of Humana small group is the Go 365 program. But with on-hand, is it my understanding Go 365 is not included in the on-hand product? Is that right?
Not on the level funded platform. So for the 51 to 99, it would be available
Okay.
and built into that. We are also launching in January. Community rated on hand will be available, and level funded or Go 365 will be built into that as well.
We are targeting to do that for January of 2023 to add Go 365 into that product as well. All of our other products on level funded premium do have Go 365 embedded. And again, with that wellness program, there's an opportunity for your members of your clients to get premium discounts based on the engagement into the program of up to 7 to 15% of their individual premium each month.
Yeah, and we've seen groups use that program. Some of the strategy that we've seen is maybe the employer pays 100% for the coverage of a base plan if the employees reach that silver status, and silver is where they get the 7% discounts.
Correct.
So it's been a great strategy, I think, overall with our Humana cases to have that embedded in the product. So the Canopy product would have Go 365 in the level funded plans, right?
Yeah, our Canopy plans are probably one of our most popular plans. We've actually added quite a few new plan designs to both our level funded and fully insured product segment on Canopy. And it's really, Canopy is kind of the direction, I think, of the industry. We're looking for ways to bring down that total premium. Typically, we see about 6% saving from our traditional plans. Canopy plan really does offer all the same benefits as our traditional copay plans. The only difference is that labs and x-rays, when a part of an office visit, aren't going to be that office visit copay, but instead deductible coinsurance.
Which lines up with a lot of the other products in the market, I think.
Yeah, it's more cost sharing. So not only those services, but ER now is deductible coinsurance on all of our standard plans. The emergency room was a copay. So on the Canopy plan, it's deductible coinsurance, and so things like that, X-ray, MRIs, outpatient type scenarios, are all deductible coinsurance. So just more cost sharing to control that premium price, and you can offer your clients a better price point.
Sure. And what I like about the Humana proposal in general is just all of those products are kind of broken down and segmented separately, so that if you want to zero in on that conversation about here's a way to lower your cost, here's a different product family within the Humana suite of products, you can kind of zero in on that Canopy line. That's great.
Yeah, and it's very similar to United's ELX plan. So if you see that, that's typically the plan that we'll pair up for you, as they're very comparable.
Good to know. Good to know. So then we've been talking about the level funded product. What separates Humana's level funded product from some of the other level funded products that are out there? I know we talked earlier about there's different surplus refunds and your runout's a little bit different. What's Humana's standard offer on the level funded side?
Well, a lot of folks look at level funded as a fully insured type of contract, but Humana looks at it as it's an opportunity for your client to earn money back if the group has a good claims experience in that 12-month contract period. So we do offer a surplus at the end of that 12-month contract period, and that surplus is 100% of what's left over minus a 6% terminal reserve fund to pay run-out claims from there. We also go, once the group's terminated, we do keep that open for 30 months run out. So Humana will pay claims up to 30 months after the contract's terminated. The caveat to getting the surplus is that you have to renew with Humana.
Yeah, it is tied to that renewal, and it does show up. What we talked about, the reconciliation, I think, is after the contract renews. Then you guys do a reconciliation and then return the funds in some form?
Yeah, so we'll take a snapshot of that surplus or deficit 15 months, so 3 months after the renewal period, and then typically about 60 days outside of that, you'll see that as an admin credit on your fee or on your bill with Humana.
Got it. So it shows up on the invoice. It's an admin fee credit. And again, depending on the size of the surplus, depending on the size of the case, that could take care of their admin fees for quite a while.
Yeah, we've seen surpluses in the tune of $30,000-$40,000 on some larger cases. This is definitely an advantage to sell Humana level funded premium.
And is there a way for an agent or an employer to really track where they're at with their surplus throughout the year?
Yeah, we offer what we call an ag stop loss report monthly to the clients and brokers, so they can track and see, and it shows right there if there's a surplus or a non-surplus scenario. So you can track that monthly up until the renewal, and so the client will know exactly where they stand each month.
Detailed accounting, I like it. That's what we're here for in
Yep.
the self-funded world. David, Leah, I think we've covered really the important stuff on the product changes and some of the things that are going on with Humana. Anything we haven't really talked about for fourth quarter that we want to make sure agents out there know?
Sure. So one thing that we just announced, which is exciting, is on our dental product, effective 11/1, on those smaller groups, 5+, 5 to 9, we used to have a waiting period for major services and ortho, and we are waiving that waiting period effective 11/1. So any new client that's in that, and it's got to be an employer-sponsored dental plan, but no waiting periods from now on at 5+. Another key thing here is that Humana's partnered with a couple chambers here in Kansas City, the Kansas City, Kansas Chamber and the Olathe Chamber. And it's an opportunity for you to get a discount on your medical level funded premium rate of about 3% and another 5% discount on specialty lines as well, Jason. Another opportunity that you can do to get savings is to bundle, obviously, dental and vision with your medical, and you get an additional 2% savings on your medical rate. What else have I?
So in the essence of busy season, we know that it can be hard to wrap up all your groups timely. We have a great enrollment platform called Launch My Group, where we're able to get groups in there. We've seen installation of an entire case within 24 to 48 hours.
When we can attest to that.
Yeah.
Yes, it's been great. It's been really nice. We just added a new feature as well, where after the group number is issued, within a couple hours, you can go out there and pull temp ID cards. So that should help people that maybe have an appointment right on the first. We know how that always happens, but it's really convenient, really easy to use, and really helps us for those groups that might take a little longer to decide what they want to do as far as their insurance.
We never need temp ID cards because groups get submitted so early. When can I expect cards is probably the number one question we get from our broker community. As you talked about ways to get savings, it used to be back in the day, David, we'd come down to Overland Park and sit in a training room with
field underwriting days.
Do field underwriting
Yes,
days,
we
right?
did.
It was all I had to do was come in with a pile of applications and plead my case with an underwriter why I needed a great rate. That you guys have shifted and really kind of been a pioneer in a different way of underwriting. We see a lot of GRX stuff, but it's kind of a mix of that. What is it that Humana's doing?
So we call it Hooray because we got it, which stands for Humana Risk Analytical Engine. And so we've taken it a little bit further than just using GRX. Our competitors use GRX, and the issue with GRX is a lot of times it doesn't pull up specialty medications and things like that. So our tool actually has 5 vendors, and obviously we do use GRX as one of those vendors, but then we have 3 other vendors that pull specialty meds as well as outpatient type services that are not captured inside the GRX data. And then we also have a vendor that pulls social data as well, just to kind of see the risk of a person and those types of things. So we run that through that little sausage maker, and then it pulls out a rate. And we feel like we can better assess the risk using our tool as opposed to just strictly using GRX, which then creates long-term stable renewals for your clients as well as competitive pricing.
And hooray, no more applications.
Yeah,
Right?
and no more applications. We just require a census with date of birth, the dependent information, and zip codes, and we can underwrite a case for you. We do also require the renewal, so we can look at that as well, engage that.
Got it. Any other pieces that we need on a Hooray submission?
So we have to have 10 plus enrolled in order to offer the GRX underwriting or Hooray underwriting. And with that, we can do it on virgin cases. So I think that's where Humana has really stood out compared to our competitors. Even if a group's breaking from a PEO or if they're currently community rated, let's get a start on underwriting right away with that, since we don't need the renewal, and we can GRX it or Hooray underwrite it with above 10 enrolled.
One of the other things we do require is if they're coming off a level funded plan currently with another competitor that offers claims data, we will ask for that as well.
Sure. Sure, that makes all the sense in the world. But I like the fact that when they're coming off of an ACA plan or their virgin group, some of the renewal doesn't really tell you a whole lot, right? Because they're not medically underwritten in that space. So to be able to turn around an underwritten proposal and go out with firm rates, it's proven successful for our agents.
One thing just popped in my head as you were talking is, Jason, you're really like the pioneer of Hooray underwriting in a sense, because back in the day, I remember that you used to be able to pull up and you take the data and have all the information on one page, and that was kind of the start of, hey, how do we make this thing more simpler? And so I look back at that back
in the underwriting
50
days.
years ago.
Yeah,
No.
back when we both had darker hair, and I had more on top.
Yeah. So I forgot about that. So yeah, you're a pioneer in making underwriting a lot easier for carriers. So
I appreciate it. I never call myself a pioneer, but I'll let you do it. Let you do it all day long. No, it was a lot of fun back in those days. I've always been an advocate of underwriting, just because I think that at the end of the day, selling a lowball rate year one just to get a case doesn't really help you keep it. You've got to work twice as hard the next year to keep it, because the renewal, if it's not priced right, you're just going to be moving that every year. And I like the stability that we have with our Humana groups, our Humana block of business, and our agents. They see the same thing. So with that, I appreciate you guys being on on the series. Any last words of wisdom for agents as they head out there?
Well, I do want to mention too, for the Kansas City brokers and clients, that we do have a narrow network option here in Kansas City that's St. Luke's based, and that's called PPOX. And you can get an additional about 13% off that rate using a narrow network option. So again, I don't want to forget about that. That's available both on community rated and level funded premium. So it's another avenue to reduce that price point for your clients.
Well, and I know in the Texas markets, we're down we've got the agents down in Houston as well. I know down in Texas there's a similar similar narrow network in just about every market that Humana's in.
Mm-hmm. And I think that one in Texas, again, I don't work down there, but very similar concept, very similar price point reduction of about 13% to your standard full-size network. So it is a strategy to think about.
Absolutely, and we're seeing more. I think we're seeing more openness and willingness from employers to narrow down the network.
Mm-hmm.
I think, but it starts with looking at claims data and seeing where your claim's coming from, and then realizing, hey, I don't need every hospital in town to be contracted. I just need a subset of hospitals that are available where my employees live. So
you can pair it with our full network too, so it would be a good option to contribute towards that narrow network. People might already be utilizing those facilities, so I think it's just a great option to allow them to have additional premium savings, and then maybe pair it for someone that might need more broad network. You can do that as well.
That's great things to think about as they start looking at proposals this fourth quarter.
Yeah, we're just excited to work with you guys and ready for the fourth quarter. If you have questions, you can obviously call myself or Leah, and we'd be happy to help you guys out.
Sounds great. Think about Humana on your next case. We certainly and certainly think about the on-hand product. If you see that on the proposal, give that a second look and reach out if you've got any questions. Until then, we'll see you next time.
Thank you.